high definition. Fox 19 News Morning Extra.
Rob, thank you. 9:34. When we come back, the face of heroin addiction is changing. Tracy's going to explain next.
I'll be right back. Well, what does the face of a heroin addict look like? Where do they live? According to the governor's office and the Department of Health and Law Enforcement, it's no longer exclusive to one area, the city or its outskirts, or to one particular group.
Dance between us. This brings on my freedom.
This is 26-year-old Adam Pendleton from outside city limits. He tried heroin for the first time at the age of 16. Said he never thought you could find it in his neck of the woods, much less become addicted.
He said it started off just being like a weekend thing, and pretty soon you're doing it 3 days a week, 4 days in a row, 5 days in a row, and you're telling yourself, that you're just getting high, or you're just having fun.
Heroin landed Adam in prison twice, a list of felonies on his record. Lost years he says he can't get back. A user for 5.5 years. He will celebrate 5 years of sobriety in September with his wife and his 2 precious little girls.
Thought it'd be fun to experiment, and I just thought it was the norm and it was acceptable to do everything else that everybody else was doing, and it never crossed my mind that I would eventually become an addict.
And that was Kaylee, a name she has chosen to protect her identity and her family's. Kaylee's eyes sparkle when she shares life growing up in the city. A loving family, lots of friends, a straight-A student. But heroin everywhere and cheap. Kaylee could get a fix in 20 minutes and as cheap as $10. Kaylee takes a breath, grinning from ear to ear. Her smile tells a story of triumph, one more day clean under her belt, but not without the help of Dr. Stuckert and the staff at a place called The Ridge in Claremont County. Kaylee just finishing 28 days in their inpatient program.
This is an actual disease of the brain, just like any other chronic disease, like asthma or heart disease. This is a disease that affects both the structure and the function of the brain. And the changes that take place in the brain during addiction promote the continuation of that disease.
Dr. Stuckert is the chief medical officer at The Ridge, a physician-directed residential treatment program, treating people from all walks of life and all ages. Their youngest patient, 18, their oldest, 63. Some hold professional jobs, some are dads, and some are moms, like Sarah. She's a young mother of 3. Her story? A little different from Kaylee's. Growing up, not so happy. Her parents divorced at a young age, her brother in a car accident. She turned to opiates to mask the pain from home, became addicted to heroin. For Sarah, the decision to go clean was brutal to her body.
Felt like I had a really bad flu. I had cold sweats, I couldn't move, I couldn't take care of my children the way they should have been taken care of. I was sick, and then I went through the detox and gone in Suboxone, and it helped me with the cravings and the chills, and it was horrible.
Steve Gifford is the clinical program director at The Ridge.
We take them out of that environment and we give them a fresh start. We work on the physical components, we work on the spiritual component, and we work on the psychological component of recovery, so that they can get a clean start, a fresh view of what life will be without their addiction.
While Adam, Kaylee, and Sarah's stories are unique, there is one similarity. They made a choice to try heroin. That first turned into a second, and then a third, and the rest is history, changing their lives forever. But they are part of a much bigger number. According to the Ohio Department of Health, the number of addicts using heroin and other opiates who are now seeking help continues to rise. These maps show the highest percentage of addicts in the counties shaded in red, an increase of 300% from the year 2000 to 2010. In an exclusive interview with the governor, John Kasich told me that the war on drugs is far from over, but he is thrilled to say that it has begun.
Alcohol mental health operations locally have pulled their resources to draw this money down. So this money, federal dollars, which we've never done before, which is amazing. We were AWOL on the war against opiates. We now have this money, and they begin to set their programs up, particularly treatment, mental health. And at the same time, though, I want you to understand that we're combining this with law enforcement as well. The Bureau of Workers' Comp is involved, the Department of Public Safety. So it's not just an education and a treatment program, but it's also a crackdown shutdown program.
Ohio Governor John Kasich recently announced that $36 million in federal funds will be poured into the state to fight the war on drugs, as well as 23 task forces are being created. In Kentucky, First Lady Jane Beshear presents $1.5 million in funding for 6 recovery substance abuse centers. And in Indiana, heroin is responsible for most overdose deaths. The Special Investigations Unit from Bloomington stating that they typically do 2 to 3 heroin buys per day. For Fox 19 News, I'm Tracy Johnson.